Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, vasospasm, triple therapy in subarachnoid hemorrhage. Why? So, first, actually, in the subarachnoid hemorrhage, vasospasm, which occurs in subarachnoid hemorrhage, is the leading cause of morbidity and mortality after aneurysms. After aneurysmal subarachnoid hemorrhage, vasospasm is the leading cause of morbidity and morbidity. So this vasospasm is treated by the drug nimodipine. So this will reduce the risk of vasospasm by preventing ischemia. It prevents ischemia and thus reduces vasospasm. Now, this cerebral symptomatic cerebral vasospasm is also treated. There is one more method of treatment. In this, we will actually increase the cerebral perfusion pressure. How is the cerebral perfusion pressure is increased? So obviously, because there is increased blood going, so as a result, the vasospasm can be prevented. So this cerebral perfusion pressure is increased by actually increasing the mean arterial pressure. If you increase the mean arterial pressure, then obviously cerebral perfusion pressure is increased. Then how are you increasing the mean arterial pressure? This is by using, you can either do plasma volume expansion. If there is increased plasma volume, there is increased uh, mean arterial pressure, or you can also use IV vasopressors. Like we can use IV vasopressors like phenylephrine, or we can also use one more IV vasopressor like norepinephrine. So with the help of these drugs and with volume expansion, we can increase the mean arterial pressure, which in turn increases the cerebral perfusion pressure. And thus this decreases the vasospasm. Then we also have one more, which is, this is one thing. One more important thing is we are increasing the high mean arterial pressure. The side effect of increasing the high arterial pressure is when you increase the high arterial pressure, this will promote rebleeding from unprotected aneurysms. It will result in rebleeding from unprotected aneurysms also. So in this case, first you will have to treat the patient. And so here we are doing two things. One is hypertension, and then we are doing hypervolemia also. We are increasing the arterial blood pressure, that is hypertension and hypervolemia. So when you are doing hypertension, when you are inducing hypertension and hypervolemia, so always you should monitor the arterial and central venous pressures also. So by monitoring the central and arterial venous pressures should be monitored while you are, this is monitored while inducing the hypertension and hypovolemia. Okay, now one more thing. When you do a volume expansion, okay, by hypervolemia, why hypervolemia? One more reason is when you give hypervolemia, increases volume, it causes volume expansion. This will prevent the hypotension, because if there is increased volume of blood, increased volume, then there will be increased blood pressure. So it prevents hypotension, and it will also increase the cardiac output, and thus it reduces the blood viscosity also. So this therapy, which is called as induction of hypertension and reduces blood viscosity, so there is hemodilution. And one more thing, this reduces blood viscosity will also reduce the hematocrit. So this is hemodilution is occurring because of this, and you are also increasing the volume. So hypervolemic therapy is done for the vasospasm, which is called as triple H therapy. That is hypertension, hemodilution, and hypovolemic therapy.
Thank you and thank you for watching.